Is it?
Well,
Where is the ladder, by the way? Good. Okay, good. Let me now have the other towel. Exactly. So, when we talk about relaxation and stimulation, massage qualities, it's not that there is different technique to, but quality of certain techniques that would be different. Yeah? Now, what can we relax and what can we stimulate? What is it that we're relaxing or stimulating? So we can stimulate relaxed muscles. That means that the tone would be reduced. Or we can stimulate muscle tone. You don't stimulate the muscle, but you stimulate the muscle tone. Yeah? So can you give me an example of when would you like to relax or when would you like to stimulate muscle tone, even in pathology?
When in what is called
Dystrophy?
Dystrophy of
Yeah.
muscle,
So-
we can stimulate them.
So when the muscle is weak,
Yeah.
when the muscle is
not used.
not used, yes. For example, the simplest example, fracture. You have a cast, you're not using it, or you've had a sprain or something, muscle tear even, the muscle get weak. Every time when the muscle get weak, you may need to stimulate the muscle tone for that. So this is one thing, muscle, we can stimulate and relax it. What
Nerve
else?
system.
Sorry?
Nerve system we can stimulate by
Good.
massage.
So what is stimulating the nervous system and what is relaxing the nervous system?
What do you mean?
What's the effect? What does it mean? Describe me a scenario that you need to stimulate the nervous system and when you need to relax the nervous system. It's quite vague. What is relaxing the nervous system?
Relax when person have stress. Yeah, you need to
Yeah.
relax the system.
Okay.
But stimulate. No.
Yeah, that's what the problem is.
Yeah, what the problem?
Autoimmune diseases.
Autoimmune disease.
Autoimmune disease, you're not stimulating the nervous system.
What was the
It's about immune system. Yeah.
Yeah, anti-stress. No, they can lethargic.
If you're
Quite
depressed,
difficult,
if you're
isn't it?
depressed
Is
and
it neuro-
If you're depressed and quite lethargic, could you stimulate the nervous system to kind of get you
Can
going?
provide the problem. Yeah.
Let's talk about what is stimulating the nervous system. What sort of, how can you maybe act it like at the end? How would the client would look like after having the nervous system stimulated? Alert?
And with pathology like multiple sclerosis.
Let's leave that pathology. Still
Can you do it
one-
on the head, mostly to relieve the
Yeah,
nerves?
In which circumstances?
That's, it's called, it would energize them, wouldn't it? It
In
would energize the person.
energize, yes.
Sports.
Yes.
If they were doing something afterwards,
Yes.
if they did in the morning.
Instead of finishing the massage and like, oh, I'm so relaxed, I'm ready to sleep. To get someone to say, oh, I'm ready, you know? Okay. Yeah.
Wake them up.
Yeah. Wake them up. That's what it stimulates the nervous system. Now, it's quite confusing. Be careful because some say, oh, I stimulate the nervous system, and they think, okay, is it the sympathetic nervous system, parasympathetic nervous system? No, you are stimulating their alertness. They feel fresh. They feel ready to go. They feel awakened. They feel refreshed. They feel that they can go and do something. So, for example, if you have someone before certain exercise or someone who needs to go to work, they still want to have the blessing of the massage, but after that, not to feel completely zombied and too relaxed. So you need to stimulate them. Yeah? Someone maybe after a long illness. Yeah?
I was just thinking about your joint mobilisation as well. Is stimulating, you're getting the joint to work
Yeah?
when it hasn't been, so you're waking it up.
Yeah.
So it's the same with bones and
Yeah.
muscles. You're just waking them up. You may be doing
Mhm.
what appears to be even a relaxing kind of stroke, but you're actually, it doesn't have to be fast and all over the place. It depends what you are trying to achieve in their body, whether you're trying to calm it down or wake them up.
So we talked about muscles, yeah, what is stimulating and relaxing. We talked about joint, yeah. If the joint was immobile, stimulate the movement. Still can be relaxing, but you're stimulating the joint, not the brain. You can stimulate the nervous system or relax the nervous system. Anything else?
Circulation.
Great. Circulation. What does it mean relaxing? Oh, can you relax the circulation, or what is stimulating and what is relaxing the circulation?
I think you just don't make it faster.
Yeah.
You
So make it slow.
Keep it on the normal.
Effleurance. Yes. Good. And how would you do stimulate the circulation?
Petrissage, faster movement.
Faster,
Deeper.
more petrissage, more dynamic. Yeah. Good. Anything else? Lisa, anything else that comes to your mind when it?
Well, yeah, I wasn't even thinking about joint mobilisation when I work with my stroke patient. I do very gentle I do all sorts of we just play funny games because just moving is stimulating the nervous system. Any kind of movement for some. So if you had someone who was paraplegic, even if you're just
Paraplegic means
they can't.
lack of.
You're not actually necessarily
Paralyzed, yes.
doing anything that looks stimulating, but it's your intention and why you're doing that, really.
Okay, so shall we start then? Yeah? Right, hold. You can do a nice relaxing hold. You can also do hold if you need to, well, you can't do stimulating hold, but instead of hold you might do some, waking up. You can do maybe like oscillation, yeah? Or deportment or vibration. Something to wake them up a little bit. You can do it at the end of the treatment also. Instead of finishing the treatment with a nice hold, you can kind of wake the whole sensory nervous system to say, wake up brain, come back to, to life, yeah? Right. Effleurage, can I do it right?
Could you go to the other side?
Yes. So the camera, can we swap over? Oh,
There was an
change.
interesting thing that came up about waking people up after a massage at the MTI weekend. And they were saying that actually quite often their patients ended up face up.
Yeah.
And they wanted to wake them up because they were asleep, but you can't really do the on their front.
Yeah.
So what would you do?
Right.
And they came through discussion, the conclusion was that you would sit them up. So you would sit them up, bring them round, but then do some tapoba on their back when they were sitting.
Okay.
So you
Can we
wouldn't.
come back to here? Yeah. Sorry. Right. What do I do now? Yes. What quality?
Fast.
Stimulating. Okay. Right. So it's quite waking. Yeah. Now, it's very subjective. They can also relax. Yeah, but it's quite subjective. But the more quicker you do, you stimulate the circulation, it still can be quite nice for them. Yeah. So. Quite different, isn't it? Even your movement of your body, can be quite different. So it's almost like this slow motion. Take it easy, do it slow. And who was it with Naoki, I think? We talked about the brain to brain. In order for you to relax them, you have to be relaxed. So you have to work on yourself to feel relaxed, to actually be relaxed, and then they can do it. You cannot do it in another way. So it's another way of encouragement for you to start relaxing and then do that. Right. Right. What do you think? Relaxing or stimulating?
Relaxing.
Could be, it's kind of,
Speed is a bit fast.
yeah, let's do that. Maybe speed a little bit slower.
It confuses me because obviously the blood, when you're massaging, you can see the redness come up. Aren't you stimulating?
That,
Circulation.
circulation, and relaxing.
And
Okay, that could be. Because there is no one thing. Yeah, I can do one stimulating, and I can do stimulation of the circulation, but I'm not. She can still be kind of subjectively also quite relaxed with it. Yeah. Okay. So stimulating. Yes. Good. Good.
Relaxation.
Mm-hmm. Good. Or you can do quite, you get it, isn't it? Yeah.
Stimulating the muscles, aren't you?
What is it? Nothing. I don't know. Stimulating of the joint and
Nervous system.
nervous system.
Stimulating it.
What does it feel? How does it feel?
It feels, yeah, I'm quite relaxed actually.
It's
But-
quite subjective. Some people might feel tense and fighting, and some people may not. So it's quite difficult to know. Yeah. Quite subjective at times. Yeah, she can be quite. Oh, what is it happening in my body? And can chat and maybe I would need to do something else, less. How is it?
Yeah, I feel like I'm waking up.
Okay. Okay. Some people would feel quite relaxed with it. It's quite. Yeah, they feel quite like zombied with it. So it's quite subjective. Yeah. But
I've seen people put babies to sleep by
by
banging
hitting them.
them
Yeah.
quite hard, rhythmically.
Yes.
Or you could have
Yeah.
light stroking, but it will work differently for two different people, won't it?
Okay. Usually, people refer to as stimulating technique, and again, not blood circulation, but more waking them up, stimulating. Yeah. Yeah. Could be. Could be. Some people may not like it because they feel that you are kind, pushing them. Who knows? So potentially, we should say potentially. Yeah, if you start doing that, stimulating, yeah.
Depends on the client.
Yeah, depends, but probably you get more sensation into that, and it's sort of like if you're completely relaxed, it will be, a bit more stimulating. What?
And I think in terms of the homework with the pathologies, this is quite interesting because there were lots of nervous system pathologies and there were lots of, I would use stimulating techniques. And I think the way to think about it medically rather than in terms of massage is that when you're stimulating, you are trying to wake up something that isn't working. Does that, because in a massage or in terms of a relaxation massage, it means something quite different to a medical, and some of the homeworks are quite medical, say in ME or the complication dealing with someone whose body isn't working properly. And it's still difficult territory if you were going there to work out what you should be doing, I think.
I have another one.
It's a deep tissue massage, and this is stimulate the muscle
To do what?
to release tension.
Stimulate the muscle to relax. So either you relax or
No,
stimulate.
to release the tension.
I order you to relax.
If you have
How does it
tense
feel?
muscle, it's like stimulation to muscle to release tension. So just
Well, it's a lot more relaxing than stimulating, but I can feel it working.
Stimulate the circulation. Not really.
You reduce the tension,
Yeah.
so you're relaxing the muscles, I would say, if anything. Yes, it is deep, but it doesn't mean that it has to be stimulating anything. You know, one thing I want you to ask you, do you think I've stimulate her fight or flight
No.
in any? No.
No.
And if I'll do now massage in a very painful way,
That will be.
that would be, because pain relates to fight or flight. So stimulating the fight or flight, even if you do deep work, should not happen. Make sense?
Yes.
Yeah? Is it enough? Yeah?
Yeah.
Should we give it a try now? Yeah? Fantastic. Good. So get into pairs and start to play with stimulating versus relaxing techniques. Are you stimulating or relaxing now? In the middle?
Yes.
Good.
Oh, that one.